to take a closer look at what does a sensory meltdown actually look like, because I want you to be able to tell the difference between a tantrum, which is that terrible twos, which looks a whole lot like throwing yourself on the floor and banging and screaming and yelling. And sometimes it's really hard to tell the difference between a tantrum and a meltdown. So I'm going to give you a list of things that you can actually look for so that you know the difference between a tantrum and a meltdown. And what I want you to take away most of all, that a meltdown is a neurological system overload, and a tantrum is a behavior caused by frustration. And that's the overarching big takeaway to know what the difference is between a meltdown and a tantrum. But we're going to go into the specifics of that right now. So a tantrum is behavioral. A tantrum is a choice. A tantrum is a person has a goal, they know what they want, and they're trying to get it. It's acting out of frustration because they're not getting what they want or they need. Think of the child in the grocery store in the checkout line. They see the sucker, they want the sucker, they want it now, they can't reach it. Mom said no. I want the sucker now! Okay, that is a tantrum because they know what they want and they're gonna let you know that they want it. They are on a mission. They have a goal to get that sucker. Now, a meltdown, and I want to look at this when we think about meltdowns. This is that system overload, that neurological system overload. Meltdowns are not a choice. That is a neurological stress response. And so they are not a choice. A meltdown is a person experiencing a overload of sensory information. They have too much overstimulation, too much fear, too much anxiety, and now they are out of control because their brain is offline, their emotions are dysregulated, their body is out of control because they're in that fight or flight, so they cannot help it. It is not a behavioral choice, it's a neurological stress response in the brain and body, and we can't just take that out, can we? So it's an automatic reaction to sensory overstimulation when stress hormones are released into the brain and body. Now, the next thing we can look at is a tantrum is an effort to communicate. They are telling you something. They know what they want and they're communicating it to you in some way, whether that's throwing a fit, they're yelling, they're screaming. And maybe they can't talk yet, and that's often the reason the terrible twos have a lot of tantrums, is because they have a hard time expressing their wants and needs, and that's very frustrating for them. And so they do have tantrums to help try to express themselves of what they're wanting. That's the difference. A tantrum is expressing what they want or need. It's words, actions, and gestures of expressing what they need. Now, a meltdown is not an effort to communicate. A meltdown is that neurological stress response. They may be yelling, they may be screaming, they may be talking, but it is not an effort to communicate. There is no goal in mind. They are not trying to tell you what they want. They are just responding with that emotional dysregulation. So the person may vocalize distress and yell and talk, but they're not trying to bargain with you like they are in a tantrum. Another thing, tantrums are for attention. And you know this already, because what do we do if we see a tantrum? We know don't give in to the tantrum because you're going to see another one. We don't want to give in to those behaviors because they're watching. Are you watching me while I'm crying? oh, you went away? Okay, well, this is not doing any good anymore. I'm going to stop the tantrum. And so tantrums are for attention, and you can watch. If they're looking to see if you're there and that you're noticing, then that's probably a tantrum. And tantrums usually stop when the behavior is ignored, right? And so we don't want to keep feeding into that. So a meltdown is that neurological stress response. So meltdowns are not for attention. They are not able to help it. So they're not trying to seek your attention. In fact, they probably don't know who is around them. And that is often how people can accidentally get hurt during a meltdown, because they may be kicking or biting or hitting or throwing things because they are in that survival mode where they are in that fight, get out of here, flee mode. So they are literally in a survival mode. They are not having the meltdown for attention. They don't care if anyone else is looking or around. It's just happening to them. A big thing about a tantrum is it stops once the goal is achieved. Here's this 2-year-old in the line at the grocery store. They get the sucker. Mom gives in and gives them the sucker. Well, what happens? All of a sudden it goes from bad to yay! And it's like this magical transformation. This little monster is now turned into this happy little angel. And that is a tantrum. If they can stop on a dime when they get what they want, they usually do, then that is a tantrum. Now, of course, a meltdown is a neurological stress response. We know that because I keep saying that because I want us to take that away. There's no desired outcome. There's no want. They are not doing this because they want something. So a meltdown can last a very long time. And it typically does, because we already know at the very minimum, we're going to have these neurological stress chemicals, the adrenaline and cortisol, in our body for at least 20 minutes and probably much more before it's absorbed and eliminated out of our body. And so this meltdown is going to take a long time. Meltdowns stop when the person actually wears out and often falls asleep, or when the nervous system finally gets enough calm. And we know that can take a very long time. And so we need to either remove the person from the stress or remove the stress from the person and help apply some of these different calming things, like getting them a cold drink, getting them some space, giving them a weighted blanket. And all these things can help calm this sensory meltdown. But you'll notice we have added a lot of calm. We have added whole droppers full of calm, if you will, and there's still a lot of red left. There's still a lot of those neurochemicals left in the brain and body. And honestly, it takes a whole lot for those to be removed and to come down. Another thing that is a big difference between tantrums and meltdowns is tantrums don't lead to self-harm. Child is aware, or the person is aware of their actions and their surroundings, and they are not going to harm themselves on purpose because they are still in control, and they might accidentally hit themselves or bump their head, but they're not going to harm themselves on purpose. They might come after someone else if they're angry enough, but in a tantrum, they are not going to self-harm on purpose. Now, a meltdown is very different. A meltdown can be dangerous. They may self-harm. I have seen people pull chunks of hair out during a meltdown. I've seen them kick and hit and bite and accidentally throw their head back and hurt themselves or someone else, but they are not doing it on purpose. They are having that neurological stress response of fight, flight, or freeze. And so that is causing all of this behavior, if you will, to happen. But they can self-harm, and they can accidentally harm others that are around them. Because you remember that thinking is offline during a sensory meltdown. They are not thinking. So a person may self-harm or accidentally hurt themselves or others because they have a loss of control of their body, because they are in survival mode and the thinking centers of their brain are underactivated during a sensory meltdown. Another way that tantrums are different than meltdowns is tantrums are due to immaturity. The 2-year-olds, that's why they're called the terrible twos. We see a lot of tantrums during the terrible twos because it's developmentally appropriate before the age of 4 for children to express their wants, needs, and emotions in a tantrum, because they do have a hard time talking and expressing themselves. So they do get frustrated easily. And they're developmentally immature, so they don't know how to control that emotion yet. I think it's also important to know that a person with developmental disabilities may also have tantrums at a later age because they may lack those skills to communicate, or they may have difficulty expressing their emotions, needs, and wants, and have difficulty controlling their emotions at a later age. Now, a meltdown can happen at any age. I, for example, about had a meltdown at one of the big box stores because I was already stressed when I went in. It was a real assault to the sensory system. It was very light, it was very crowded, it was very noisy, and I had a hard time coping with that. So neurological stress responses can happen at any age, but the wonderful thing about it is that coping and control strategies can be learned to recognize those early symptoms of sensory overstimulation so that we can reduce those neurological responses going in. And we don't have as many, so we can nip them in the bud, is what I like to say. So we're preventing these neurological stress chemicals from going in the first place. Now I'd like to talk about a sensory shutdown and what that looks like. That is also a neurological stress response, just like a sensory meltdown, but it looks different. Instead of being that fight or flight part, a sensory shutdown is the freeze part, where they are actually tuned out, zoned out. They might look like they're in a trance or almost in a coma. They might be completely oblivious to what's going on around them. They might hide in the room. They might go under the teacher's desk or hide in a corner or hide in some kind of play place. They're going to probably cover their head and their face because they are in a sensory stress response called a sensory shutdown. A sensory shutdown can be confused for non-compliance because a sensory shutdown looks very much like a person that is just avoiding it. They don't care. They don't want to participate. I'm zoned out. It can look like a very purposeful non-compliance. But a sensory shutdown is also that neurological stress response, that freeze, and they literally can't help it. They are in a freeze state. So sensory shutdown and non-compliance can look really similar, but they have different root causes. One is a brain-body neurological response, and it requires a very different action. And non-compliance is a behavior. It's a choice. So just to recap what we've talked about, shutdowns and meltdowns occur when the brain is not able to process that strong influx of sensory information, such as bright lights, loud noises, strong smells, aversive textures. When the sensory system is overloaded, it causes those stress hormones to be released into the brain and body, which causes that fight or flight or freeze. And a shutdown is a freeze, and a meltdown is that fight or flight.